Clock. A very good morning to you. You're listening to Daybreak with me, Muriel Disa, only on Talk 100.3. We're part of the Fun Asia Network. Now, answering all our queries, we are joined by Dr. Arun Dungarwal. He's a specialist orthopedic surgeon all the way in NMC Medical Centre, Ajman. He's here to talk to us about the aches and the pains that we go through every single day, and it is to do with our knees. A very good morning to you, Doctor, and welcome to the show.
Very good morning.
Doctor, let's start off with the first question, right? So many people think knee pain is just a part of getting older. Is that really true, or should we be concerned when it starts? And when does it actually start?
First of all, thank you for asking this question, because this is probably the biggest misunderstanding about the knee pain. Almost every day in my clinic, someone tells me, "Doctor, I am getting older, so I have accepted the knee pain is a part of my life." My answer is always same. Getting older is natural, but living with pain is not. Let me ask everyone listening today a very simple question. Have you ever seen people in their 70s who still go for morning walk, travel with their family, climb stairs comfortably, or play with their grandchildren? Of course, you have. That tells us that age alone is not the reason for knee pain. Okay, let me explain you in a simpler way. Think of your knees like the tires of a car. If you drive carefully, maintain the air pressure, and service the car regularly, the tires last much longer. But if you overload the car, never check the tires, and keep driving on rough roads, they wear out much faster. Our knees are exactly the same. Over the years, our knee carry out entire body weight every single day. They help us in walking, climbing stairs, sitting, standing, praying, and even dancing. So naturally, they experience wear and tear. But pain is not something you should simply accept. Sometimes the pain is because of extra body weight. Sometimes it happens because the muscles around the knee have become weak. Sometimes it is due to an old injury that was never treated properly. And yes, sometimes arthritis is the reason only. The important thing is to find the real cause instead of assuming it is just an old age. One mistake I see very often is that people ignore the pain for months or even years. They keep applying pain relief gels, taking painkillers whenever the pain increases, and hoping it will disappear on its own. Unfortunately, many knee problems become worse because treatment is delayed. The good news is that today we have many effective treatments. Not every patient needs surgery. In fact, many people improve with simple exercises, weight reduction, medicines, and few lifestyle changes. So, my message to everyone listening today is very simple. Please don't think I'm getting older, so I have to live with this pain. Pain is the body's way of talking for help. Listening to it early, and in most cases, we can help you stay active and independent for many years.
That's really, really nice, Doctor. How can someone tell the difference between normal knee pain after a busy day and a knee problem that needs medical attention? Because that only a doctor can tell and not a layperson.
Really, that's another very practical question, because all of us have experienced body pain after a long day. Suppose you attend a wedding, go for shopping for several hours, or travel all the day, or spend the whole of the day in cleaning your house. It is quite normal to feel some tiredness and mild pain in your knees by the evening. Usually, such kind of pain after a good night of sleep or 1 or 2 hours of rest, the most of the discomfort improves on its own. That kind of pain is generally not a cause for concern. But there is another type of pain that should never be ignored. If your knees hurts every morning when you get out of the bed, if you avoid climbing stairs just because of pain, if you have difficulty in getting up from the chair, if your knees become swollen, if it suddenly gives way while walking, or if pain keeps coming back every few days, then your body is telling you that something needs attention. Many people tell me, "Doctor, I thought it would settle on its own. Sometimes it does, but many times it doesn't. Waiting too long can allow a small problem to become bigger one. Another important point is pain after injury. If you slip or fall or twist your knee while you were playing sports or hear a popping sound followed by a swelling, please don't assume it is just a sprain. It is always better to get it checked early. Early treatment often means faster recovery. I also want to tell our listeners something very important. Painkillers are not the solutions. Painkiller only reduce the pain for a few hours. They do not tell us why the pain is happening. It is just like switching off the fire alarm while the fire is still burning. So don't only treat the pain. Find the reason behind the pain. My advice is very simple. If pain is affecting your daily life, your sleep, your work, or your confidence while walking, don't wait. Meet an orthopedic doctor. Earlier we diagnose the problem, the easier it is to treat.
Absolutely. We are in conversation with Dr. Arun Dungarwal, a specialist orthopedic surgeon, NMC Medical Centre in Ajman. It's very simple to book an appointment. Go visit doctor. If you need the link, I'll be more than happy to send this across to you on 0586861003. You heard doctor say this. Please do not ignore any of your pain. Now, right now, doctor, what are some of the common daily habits that can silently damage our knees without us realizing it?
And that's very interesting question because many times our knees are not damaged by one big injury. They are affected by our daily habits. People often ask me, Doctor, I never had an accident, then why do I have knee pain? The answer is that our lifestyle plays a very important role. Let me give you a simple example. Imagine you have a mobile phone. If you charge it regularly and use it carefully, it works very well for years. But if you keep dropping it, never charge it properly, and ignore small problems, it will stop working much sooner. Our knees are very similar. One of the biggest reasons I see is being overweight. Many people don't realize that every extra kilogram of the body weight increases the pressure on the knee whenever we walk, or climb stairs, or even stand up from a chair. The knees have to carry that extra load every single day. Another common habit is sitting for long hours. Nowadays, many people work on computers or spend hours watching television or using their mobile phones. The body was designed to move. When we sit continuously, the muscles around the knee become weak, and the weak muscles cannot support the knee properly. Then there are the people who do exactly the opposite. They don't exercise the whole week, and suddenly on the weekends they play football, cricket, or go for a long run. Our body doesn't like sudden changes. Just like you cannot expect a parked car for 6 months to perform like a racing car, your body also needs a regular activity. Footwear is another thing that we often ignore. Wearing uncomfortable or worn out shoes for a longer period can change the way we walk and put unnecessary stress on the knee. And one habit that worries me the most is ignoring small injuries. Many people twist their knee, feel pain for few days, and then continue with their normal routine without getting it checked. Months later, they come with the persistent pain because the original injury was never treated properly. So, what we can do? The answer is actually very simple. Keep your body weight under control, stay active every day, even if it is just a 30-minute walk, strengthen your leg muscles. Wear comfortable footwears, and most importantly, don't ignore pain that keeps coming back. I always tell my patient this, your knees take care of you every day. Take care of them before they start asking for help.
Very interesting. Now, a lot of people, doctor, ignore knee pain until it really becomes severe. Are there any warning signs that tell us it's time to see a doctor?
Yes, absolutely. I'm very happy you asked this question because many people wait far too long before seeing a doctor. In my clinic, I often hear people say, Doctor, I thought the pain would go away, or My neighbor told me to apply some gel or oil, or someone suggested a painkiller, so I kept taking it. Sometimes these things gives temporary relief, but they don't solve the actual problem. So, when should you see a doctor? First, if the pain continues for more than 2 weeks despite taking rest, don't ignore it. Second, if your knees become swollen, and specifically if the swelling appears suddenly, it needs proper evaluation. Third, if you find it difficult to climb stairs, getting up from chair or walk normally, that is another important sign. Another warning sign is when the knee suddenly feels unstable. Some people tell me, doctor, it feels as if my knee is slipping, or it suddenly gives way while walking. That should never be ignored, because it may lead to a fall and a more serious injury. If you have had a fall, a sports injury, or a twisted your knee, and you hear a popping sound followed by the pain and the swelling, please don't wait for weeks hoping it will settle down. There is one important point that people often forget: pain at night. If your knee pain is disturbing your sleep or waking you up at the night, it is a sign that you should get it checked. I always compare it with the warning light in your car. When the warning light comes, you don't break the bulb, so you can't see it anymore. You take the car to a mechanic to find the real problem. Pain works in exactly the same way. It is your body's warning light. Then don't just switch it off with painkiller. Find out why it is happening. And finally, I want to reassure all our listeners that seeing a doctor does not automatically mean surgery. In fact, most patients do not need surgery. Many people improve with the right exercise, lifestyle changes, medicines, and sometimes physiotherapy. So please don't be afraid of getting your knee checked. The earlier we identify the problem, the easier and the more successful the treatment usually is.
Right. Now, Doctor, very interesting. I love the kind of examples you're giving, with with the daily examples. I mean, whether it is a car, whether it is your life, it's really, really easy to understand. Now, many of our listeners ask whether, say, climbing stairs, walking or exercising makes knee pain worse. So should we keep moving or rest the knee?
That's a wonderful question, because almost every patient asks me this question. Some people say, doctor, my knee hurts when I walk. So, should I stop walking? Others says, my family told me to take complete bed rest. The truth is, neither extreme is right. Our knees are made to move, just like a door works smoothly when it is open and closed regularly. Our joints also stay healthier when they keep moving. If a door is locked for years, and it will become stiff. Our joints behave in a similar way. So, in most cases, gentle movement is actually good for the knee. A slow walk, simple stretching exercise, and strengthening the muscles around the knee help to improve support of the joint. Strong muscles reduce the pressure over the knee and reduces the pain. But there is one important thing. Don't confuse exercise with over-exercise. Many people suddenly decide to lose weight and start running long distance or climbing hundreds of stairs on the first day. The body doesn't like sudden changes. Imagine someone who have never driven a car before, and you wouldn't ask them to drive 500 kilometers on the first day. You would start slowly. Exercise is exactly the same. Start with small steps. Increase your activity gradually. Listen to your body. If an activity causes only mild discomfort that settles quickly, it is usually acceptable. But your knee becoming swollen, the pain becomes severe, or you cannot walk afterwards, then the activity is too much for your knee at that moment. Another thing I want to tell everyone is that pain should not stop you from living an active life. Many people become afraid. They stop walking. They stop going outside. They avoid playing with their children or grandchildren. As a result, their muscles become weaker, they gain weight, and the pain actually become worse. So, staying completely inactive is also harmful. My advice is very simple. Keep moving, but move wisely. Choose activities that are gentle on your knees, such as walking on flat surface, cycling, swimming if it is available to you, or the exercises recommended by your doctor or physiotherapist. And remember this one line: rest when your knees need rest, but doesn't let your rest become your lifestyle. This is the one message I hope everyone listening today remembers.
Absolutely. We are in conversation with Dr. Arun Dungarwal, a specialist orthopedic surgeon, all the way from NMC Medical Centre in Ajman with over 21 years of experience. So what are you waiting for? Book an appointment right now. If you need the link, I'll be more than happy to furnish that across to you on 0586861003. Now, Doctor, getting back to the conversation, what are some tips, simple ones though, that people can follow every day to keep their knees healthy and avoid knee pain in the future?
I really like this question because prevention is always better than the treatment. People often ask me, Doctor, what is the one medication that keeps the knee healthy? I smile and tell them, the best medicine is being healthy. Let me share a few very simple tips that everyone can follow. First, keep your body weight under control. Your knees carry your body weight every single day. Even losing few kilograms can reduce the pressure on your knee and make walking much easier. Second is keep moving.
Right.
You haven't to become an athlete. You don't have to spend hours in the gym. Even a 30-minute walk on most of the days of the week is wonderful habit. Third, make your leg muscles stronger. Strong muscles work like natural supporter of your knees. When the muscles are strong, the knee doesn't have to work as hard. Fourth, wear comfortable footwear. People often spend a lots of money on the clothes and watches but ignore their shoes. Good shoes supports your feet, improves your walking pattern and reduce unnecessary stress on your knee. Fifth, avoid sitting continuously for long hours. If you work in an office or spend a lot of time at the desk, stand up every 30 to 45 minutes, walk around for a minute or two, stretch your legs. Your knees will thank you. And finally, don't ignore small problems. Many serious knee conditions start just with the mild pain. If you see advice early, treatment is usually much easier. Before I finish, I want to leave everyone with one thought. We regularly service our cars. We charge our mobile phone every day. We even water our plants. But we often forget to take care of the joints that carry us throughout our lives. So please, give your knees the same attention. A little care today can keep you active, independent, and pain-free for many years. Healthy knees means healthy, active life.
A very good morning to you and welcome once again to Daybreaker with me, Muriel Disa, only on Talk 100.3. We're part of the Fun Asia Network in conversation with Dr. Arun Dungarwal. He's a specialist orthopedic surgeon, 21 years of experience, all the way from NMC Medical Centre in Ajman. Now, Doctor, we are left with two most important questions. One, does being overweight really put extra pressure on our knees, and can losing a little weight make a noticeable difference?
Definitely. This is one of the most important questions because nowadays many people are struggling with the weight gain. When I tell my patient that losing weight can reduce knee pain, some of them smile and say, Doctor, can losing just a few kilograms really make such a big difference? My answer is always yes. Let me explain it in a very simple way. Imagine you have to carry 5 kilograms of bag for just 5 minutes. It may not seem too much difficult. Now imagine carrying that same weight every day from morning till night for many years. After some time, your shoulders, back and the leg will start feeling tired. Our knees experience something similar. Every step we take, whether we are walking or climbing stairs or getting up from chairs or carrying groceries, our knee supports almost entire body weight. So when body weight increases, the knees have to work much harder. The good news is that You don't have to become extremely thin to feel better. Even losing 5 to 10% of your body weight can make a big difference. Patients often tell me, Doctor, I can climb stairs more easily now. I don't need painkillers as often. I can walk longer without stopping. These are the benefits of reducing weight. Now, I also want to clear one misunderstanding. Many people think that because they have pain, they should stop walking. As we discussed earlier, staying inactive often leads to more weight gain, weaker muscles, and even more pain. So, instead of stopping all activity, choose activities that are comfortable for your knees. Walk on a flat surface. Do simple stretching exercises. Eat a balanced diet. Sleep well and lose weight gradually. There is no magic medication for weight loss. A small changes done every day gives the best long-term result. I always tell my patients something very simple. Your knees don't know your age. They only know the weight that they are carrying every day. If you reduce that load, your knees will definitely thank you.
What a beautiful way to say that, doctor. Now, let's ask you the last question. Do home remedies like cold or hot packs actually help with knee pain? When should we actually use them?
Yes, they can definitely help, and this is one of the most common questions people usually ask. Many people become confused. Some says, Doctor, my neighbor told me to use hot water. Others says, someone else told me to apply ice. So, which one is correct? Actually, both are correct, but they are used in different situations. Let me explain. If you have just injured your knee and maybe you slept or twisted or the knee suddenly becomes swollen, then cold pack is usually the better choice. Cold helps reducing swelling and gives temporary pain relief. You can wrap some ice in a towel or use cold pack and apply it for 15 to 20 minutes at a time. Now, let's look at another situation. Suppose your knees have been painful for months. It feels stiff when you are wake up in the morning, or after sitting for a longer time, your knees feel tight and difficult to move. In these situations, a warm pack is more often comfortable. Heat relax the muscles and help the joint move more easily. But I also want everyone listening to remember one important thing. Hot and cold packs reduce discomfort. They do not cure the actual problem. It is similar to having a leaking profile. Suppose putting a bucket under the leak will stop the water from falling on the floor only, but it won't repair the roof. The same is true about knee pain. If your knee pain continues for weeks, keeps coming back, or it is getting worse, don't keep depending only on the home remedies. Find out the real reason behind the pain. One more thing, please be careful with very hot packs or ice applied directly to the skin. Always use towel in between. We don't want to treat knee pain and end up causing a skin burn. My advice is very simple. Home remedies are helpful for temporary relief. But if the pain is persistent, increasing, or affecting your daily life, don't delay seeing an orthopedic specialist. Because the sooner we know the cause, the sooner we can start the right treatment.
Well, that was well said, Doctor. Thank you. In fact, we're getting so many messages. This was Dr. Arun Dungarwal, all the way from NMC Medical Centre in Ajman, with over 21 years of experience. Now, if you need the link to book an appointment, you can always reach us out on 0586861003. Doctor, anything more that you would like to add before you leave?
Before we end today's discussion, I would like to leave everyone with one simple message. Our knees work for us every single day. They help us get out of the bed, go to work, playing with our children, enjoy holiday, and remain independent. Unfortunately, we often start paying attention to them only when they begin to hurt. Please don't wait for that stage. stay active, maintain a healthy body weight, exercise regularly, wear comfortable footwears, and most important, don't ignore pain that keeps coming back. Remember, most knee problems can be treated successfully if they are diagnosed early. Not every patient needs surgery, and many people recover with the simple treatment and lifestyle changes. Finally, I would like to say this: take care of your knees today so they can take care of you tomorrow. Thank you so much for having me. It was pleasure speaking with all of you, and I wish everyone good health and pain-free moment.
Thank you very much, Dr. Arun. More power to you. We look forward to more conversations with you.